Hello, everyone, and welcome to today's podcast brought to you by ConCensis Technologies. I'm your host, Tyler Kern. Thank you so much for joining me for this episode of the show. My guest today is Kelly Swails, and she is the Senior Clinical Educator for ConCensis Technology. Kelly, welcome to the program. Thanks for joining us.
Thank you for having me.
Absolutely. We're thrilled to have you on and to get to learn a little bit more from you today here on the podcast. So today we're talking about documenting the life cycle of a container. As a clinical educator, you help medical facilities optimize their use of CensiTrac, which makes documenting processes easier and more efficient. But to start off, Kelly, will you go through the life cycle of a container and highlight which of these steps or processes that are sometimes overlooked in documentation?
Yeah, so you think of that life cycle of a container, it's never ending. And so we'll start with decontam. So that's where they go in and they get cleaned. And that would probably be the number one area that I see where it's not documented. So the sets come through decontam, they go through a pre-clean, go through the washers. And, if you have a tracking system, wonderful. You then have that capability to, with CensiTrac, scan to that decontam module. You've now documented in that container history that set was cleaned. However, if you don't have a tracking system, then you have to write it on paper. But even for those that do, many times I see that they're skipping that part, and that may be due to lack of computers, lack of knowledge or education, knowing that they should be doing this and that it should be documented, in accordance with AAMI guidelines. It should be documented that it was cleaned. So then once it's cleaned through decontam, it comes to assembly. That's I do see good compliance there because they use that to the container assembly to assemble their containers, which then prepares them for sterilization. As we come to sterilization, here again, you're building your sterilizer loads. I will sometimes see that sets are missed. So when you are, scanning your sets to that sterilizer load, really recommend that you scan like you're reading a book. So left to right, top to bottom, and then from there, count everything on that rack and compare it in CensiTrac to that total scanned. Those numbers should match. If they don't, I recommend recounting. Maybe you missed something. Still don't match, you can either clear the screen, start over, or as I say, phone a friend. Have somebody go through your list as you're going through the items, figure out what was missed. After sterilization, then that set will go to sterile storage, or it will go to a clinic or an inpatient or an ED. It may go right to an OR. So there it kind of goes to where it's going to be stored and then point of use and then back to decontam. So that's that cycle that's never ending. And the two key areas that I see that are missed are decontam and then sterilization.
That's really interesting. Do you have any theories as to why that is?
So with decontam, as I said, I think sometimes it's lack of computers. So lack of having a computer or a handheld scanner or a tablet. All of which you can use with CensiTrac. And then with sterilization, I think when you're scanning in CensiTrac, it's quick, boom, 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 you're going through. That's how fast our program goes. But what happens is sometimes people go too fast, and so then they miss something. They don't realize that there was a peel pack in this rack that they missed. Or if you have a lot of little containers, one of them can get missed because maybe it's hidden behind a larger container.
So, Kelly, ConCensis is, of course, always working to stay ahead of the curve and bring new enhancements and features. Can you go over maybe some of the most used and least utilized features that ConCensis offers?
Yeah. So, thinking of the life cycle of a container, as I said, that container assembly, sterilization, that's probably our most used that you'll see that, along with the peel pack module, because, it's nice to just type in NL1400, and it pops up. It's an etch with teeth, print my label, throw it on my peel pack pouch. So a lot quicker than having to hand write that out, write out the date, write out my name. So those are the features I see used the most, along with our scope module processing or HLD processing. See that being used by your endoscopy units. And then when you come to the least amount used would probably be our patient care module. So if you're cleaning and reprocessing patient care equipment and then sending it off to the floor and the such, we do have a feature for that with that module that you can use. Excellent way to know where those assets are in your facility, and then keep track of those preventative maintenance, the cleaning, how am I supposed to clean it, and then who cleaned it. And then there's just a lot of different little features and functions that we have that They're not always being utilized. So for example, out of sequence is a wonderful patient safety tool. It's probably one of my favorite features of CensiTrac. And what that can do is it can help prevent an unsterile item from leaving your department and making its way to a patient. And so with that, if you miss one of those key scans, you're going to get a pop-up saying, stop, this item hasn't been sterilized. I look at this in my hand and go, oh my goodness, the tape hasn't changed. I almost sent this to the clinic. Or I look at it and say, well, the tape changed and I took it out of the sterilizer. I know it was. Well, that tells me whoever created that load, they missed it in that scan. And so that's where, it's kind of, you got to count, make sure everything's on there. And then I encourage everyone to enable that that sequence tool, just so that way you know that everything is being done and you're keeping your patient safe.
That's really interesting. And you made some really interesting points there. And from my perspective anyways, when I hear you describe this, I think, man, that really helps increase efficiencies and reduce mistakes and things along those lines. But how would you respond to someone who might say that this makes things more complicated? What would your response be?
Yep. So I do hear that from customers, when I'm on the floor providing some training or asking questions. I have had customers say to me, oh, you're just giving us busy work. Why are you making us do this? And I've said to them, I'm not having you do anything. CensiTrac is not requiring you to do anything. What you're doing is you're complying with, FDA, AMI, ARN, etc. And what we do is we provide you the tool so that you can easily and efficiently do your job. So think of it as we're not setting the rules. We're not saying you have to do this. We're giving you the tools so you can do it better, faster, and with success.
And that sounds like a win-win to me. Isn't that everyone's goal, to be able to do the same things but quicker and with a higher rate of success? I mean, that seems to me to be the goal of just about anything that people do these days. Is you'd like to be able to do it as quickly as possible, and you'd like to be able to do it with as few mistakes as possible.
Correct. Think of when you're going to. So if you ever do the self-checkout, at your grocery store, and as you're just scanning everything through, it's quick. Or even if someone else, if you have a cashier checking you out, they're just scanning things through. Well, imagine having to hand write out every single thing that's in that cart. And I know, some of the shopping I do, I'd probably be there an hour writing everything down. And so right. Having that capability to quickly scan it's wonderful. We've come a long ways with our shopping. Well, sterile processing is kind of the same thing. We give you that tool so you can just scan.
That's a fantastic way of putting it. I really like that comparison and that analogy. So when it comes to talking to customers and talking to people that use CensiTrac, what are some of the more common questions that you get? What are people asking you?
I'm trying to think with my, because I go to hospitals all over the U.S., Canada, Puerto Rico, and do assessments of how they're utilizing CensiTrac. And so a lot of the questions I get would probably be more, lately I've been getting questions regarding like an integrity test. So for example, if you have a laparoscopic grasper and it's insulated, you have to do insulation testing every time you assemble that. So I've been getting a lot of questions from customers asking me, how do we know that this requires a test? Or can we say that yes, it was done? So then I show them in our products module, you can go in, check the box for integrity test required, and then along with that, it's free text. So you can type in, you must do a insulation test on this. Or if it's a arthroscopic shaver, you have to check the lumen with the borescope. So you can give them, specific directions, and then they have to click the box that they've done it in order to be able to peel pack it, or in order to be able to add it to that container to fulfill that container for sterilization.
Interesting. I wonder if, over the past 18 months, 2 years or so, if hospitals haven't maybe seen firsthand the importance of efficiency and seen the benefits that something like CensiTrac could provide. Is that something that has been communicated to you at all? Just that more and more people have understood why it's important to be efficient and flexible and adaptable during this time?
Yes. So, I do feel, and what I see out in the field is that many departments are short-staffed. There is a demand for sterile processing technicians. And so everyone is scrambling, everyone is hurrying and rushing, but yet at the same time, you don't want to rush because it's quality over quantity. And so as you're looking at how people are kind of having to make changes or adapt to this new world we live in with the pandemic, with maybe you don't have all your staff because people are out sick. You can really see where CensiTrack, they're reaping the benefits of it, and they're thrilled that they have it because they do understand how it makes their job easier.
Certainly. So Kelly, earlier on in the show, I mentioned that Censis is always working and striving to stay ahead of the curve and bring the latest and greatest and the newest technology to this industry. Are there any other Censis products that you want to highlight that you can talk about that might be coming in the future, or any updates to CensiTrack, anything along those lines that you want to share with us?
Yeah, so I think one of my favorite products that we have that's outside of CensiTrack is LoanerLink. As I tell everyone, it's every SPD manager's dream come true. When I was an SPD manager, our loaner room would get to the point where, we became a storage facility, and whether it was just empty bins that they transported or shipped to us with a local courier, or if it was all their trays, that you couldn't walk in there. And then I have to, be emailing and calling all these reps to say, come get your stuff. Well, now with the LoanerLink, you can manage that and set it so that way when the scheduling department creates a case and they say, Dr. Smith's going to do a total knee revision. And then as they fill this out in LoanerLink, they just kind of click the box. Then it pings that rep saying, hey, Dr. Smith's going to do a total knee revision on this date and time. That rep then goes in and selects what trays he's going to bring in. Then it now loads into CensiTrack into our loaner module. And so then when they arrive, you go in, find it, check it in, print out your labels, you're good to go. Then as you're scanning it through, decontam, assembly, sterilization, etc., that rep can always be looking at his phone, at the app, and seeing, where his sets in the process. Are they ready? Nice for that rep. He can look and go, okay, good. They're on the case card. They're outside the OR. He knows there's no delays. There's no problems. He gets on site for the case, and everything is beautiful. Then as they finish the case, come back to decontam, and scan those into decontam, he can then see, oh, good, they're in the washer. I'm in the neighborhood. I'm going to stop by afterwards and I'll go get some lunch and stop and pick them up or something. But then he's also getting pings saying, beforehand saying, hey, your sets are due in 24 hours. Or, your sets are due or your sets are overdue if you haven't dropped them off. And then even when they're ready to be picked up, he can get a ping saying, your sets are ready for pickup, come get them. And then you can keep getting some pings saying, come get your stuff if they are there too long, so you're not becoming a storage facility.
Exactly. That's an excellent point. And I think I really appreciated the transparency that goes throughout that entire process, right? That you could see where things are in the process so that you know exactly where you are, what's happening, and what's coming next, right?
Yes. Yeah. I mean, so it's a win-win. And then even with OR Scheduler, which is your electronic medical records, so your EMR, you link it with CensiTrack. Many departments, if not all departments that have an OR, the morning you create a needs list, what's a priority, what are we turning over that day, what do we need to make sure we keep moving. But the minute a surgery cancels, gets added, a time changes, that list is obsolete. So with OR Scheduler, it's all in real time, or depending on what EMR you have, you may have a few minute delay, but even so, 5-minute delay is nothing when you're looking at your list there. And so with that, you can always look at your board and know the status of what's needed. And then if it's green, it's good to go, no worries. If it's yellow, hey, it's in the sterilizer, but it's needed this evening, so we're good, but just keep it on your radar and keep it moving. So stuff like that. And then the nice thing is that it links that set to that procedure. So if you look at AMI guidelines, I believe FDA too, they mentioned that, we need to know what set was used on which patient. So if little Johnny comes in for a tonsil and adenoidectomy, 9 out of 10, you're always only going to use that TNA tray. But we need to know that TNA tray number 3 was used on little Johnny. And this is an easy way to do it because as you're building that case cart and scanning it in, it's linking it to that procedure. So if there's ever a tracer, root cause analysis, you can then also, pull that up and look and see what set was used on that patient. You can pull up that history. Yes, it went through decontam, went through assembly, went through sterilization, and everything is marked with a date and time stamp along with the user. So you've got all that pertinent information right there, easily accessible.
Well, Kelly, you've provided a lot of fantastic information today, regarding the life cycle of a container and the role that ConCensis plays in that process. Do you have any final thoughts, anything you want to leave our audience with here today that you want to make sure that they walk away with, especially regarding ConCensis and that life cycle of a container?
I'm a firm believer in you don't know what you don't know. And, I always encourage everyone to really keep up on your AMI guidelines, your AORN, see what they're recommending, what you should be doing, and then also then asking, how can I do this in ConCensis? And if you have questions, reach out to our help desk, reach out to your client manager, and, always there, always willing to help, always willing to provide assistance, or like I do, where I go out and I do assessments, I look at all that and see how are you using all the modules. I look at everything A to Z. And then also, if there is something you're not using, or maybe you're not using to its full potential, then I can help with arranging to have a trainer come out. That trainer comes on site, and then they work with your staff and train the staff, so that way you can maximize your ConCensis usage.
Excellent stuff. Excellent stuff. Kelly Swails, Senior Clinical Educator for ConCensis Technologies. Kelly, thank you once again for joining us here on the podcast today.
Thank you so much for having me.
Absolutely. And everyone, thank you for joining us for this episode of the podcast. Stay tuned for more from ConCensis Technologies. But for my guest today, Kelly Swails, I've been your host, Tyler Kern. Thanks for joining us.